For the first time in nearly 40 years, health officials in the UK have identified a likely outbreak of polio in London. The last case of polio in the UK occurred in 1984. The UK was declared free of polio in 2003. So far, there have been no cases of polio detected directly in the UK, but instead, scientists have discovered the outbreak through an indirect route. They've found multiple versions of the virus in sewage water, the UK Health Security Agency said Wednesday in a press release. The risk to the general public is extremely low, the agency said. Because the vast majority of people in Britain are vaccinated against polio during childhood, and therefore protected against infection. But the agency encourages anyone not fully immunized to schedule an appointment right away. Between February and May, UK, scientists found several samples containing closely related versions of the virus in wastewater at the London Beckton Sewage Treatment Works, the largest water treatment plant in the UK. The virus's genetic sequences suggest there has been some spread between closely linked individuals in North and East London, the UKHSA said. People infected with polio, or who have been vaccinated with a live version of the virus, shed traces of the virus in their stool, which eventually end up in sewage wastewater. So the current hypothesis is that an infected person brought the virus into London and then spread it to others who weren't immunized. It sounds like the outbreak is very small, says virologist Angela Rasmussen, who studies polio at the University of Saskatchewan in Canada. The outbreak could be within an extended family. Transmission would require a concentration of people who had not yet been vaccinated. Scientists in England are quickly expanding surveillance of sewage samples to try and pinpoint where the outbreak occurred and whether it's still ongoing so they can stop it with targeted immunization. We are urgently investigating to better understand the extent of this transmission, said epidemiologist Vanessa Saliba, who consults for the UKHSA, in the statement.